Living a poorer life will likely mean living a shorter, less healthy life. And even though life expectancy has risen in Scotland, health inequality between those in prosperous households and deprived ones is the worst in Western Europe. In our final analysis of inequality in Scotland, Douglas Fraser is looking at how the economy plays a part in our well-being. Douglas.
Thanks very much, Sally. Yeah, how long you can expect to live has long been linked to your prosperity. But with health provision for all, free at the point of need, does it have to stay that way? Even with record spending on NHS Scotland, the gap is persistent. Now, if you look at our typical Scots, a child born into one of the 10% most deprived households in Scotland can expect to live a healthy life for less than 50 years. And that's before an average 23 years of unhealthy older age. A child born into the most prosperous 10th of households can expect to live in healthy conditions until 73 and live with poorer health for another 10 years or so. Now, all groups of people are living longer, but that gap widened a lot during the 1980s and 90s. In the past 10 years, that gap's remained, but it's been more stable. Now, what about mental health? Those living in the most deprived communities are 5 times more likely to have below average mental well-being than those in the most prosperous areas. So, should the £12 billion budget prioritise more deprived patients? That's what we put to 2 GPs in 2 very different parts of notoriously unhealthy Glasgow.
I'm Rob Johnson. I'm a GP in Curzon House Surgery in Mulgai. Our practice is defined very much by having a large elderly population. These are people at the end of their lives who have very complex and demanding needs, which we are keen to meet in the community, but are currently struggling to do so with the resources we have.
My name's Lindsay Crawford and I am a GP here in Balmore Surgery in Postle Park in Glasgow. So our patients in their late 40s and 50s have the sort of bag of problems that you would normally only see in someone in their late 60s and into their 70s. Some of our diseases that we have were 4 times above the national average. So we need more money to treat that effectively. Or all you're doing is putting an elastoplast over a gaping sore.
Albeit this is an affluent community, what often happens is that families move away and elderly parents are left here, and we're often the first port of call for both the patient and supporting services when things go wrong. For every patient we visit at home, we could see 4 patients in the surgery, so it's quite an inefficient use of GP time, but a necessary use of our time.
Lots of our patients have their health problems, but also there's huge amounts of poverty here. Having to pay more money to try and keep their house warm and for their kids damp. They've got no control over the house that they live in. They're terribly worried about money, particularly with changes to the benefit system.
The fear would be with our patient group that if we were inadequately funded, needs of our patients would not be met in the community and they would simply reappear somewhere else in the system. And that's certainly not what patients want, and I can assure you it's not what taxpayers want.
I know that we all here in the surgery have the waking up at 2 in the morning, suddenly remembering something or worrying because we've got so many things that we're juggling. You can't possibly expect people to do more and see more people, but with less money. It's common sense that isn't going to work.
So what can we do about this inequality? Professor of General Practice Graham Watt says there's no one policy that can help.
We've seen in the last 30 years increasing social exclusion, both at the bottom, people fall out of the economy, and at the top, where people feel apart from society, and why should they pay for it? I think that's an unfortunate trend. I'm very sceptical about specific policies to address health inequalities. I think if I had that degree of control, I would give everyone a day off and the opportunity to reflect seriously with others about the situation that they're in and what they could do differently.
Goodness, it's complicated, Douglas. The NHS is mainly there to fix us. Often it happens too late. How does it need to change its approach then to do this differently?
Well, you can see this problem of poverty as having to do with poor diet, little exercise, alcohol, drugs, but that's really dealing with many of the symptoms of poverty. And the health experts say we should be looking far more at the roots, at the causes, the underlying causes of poverty. So when the recommendations they're putting to government have to do with income levels, with the jobs market, with secure jobs, with housing, public transport, clean air. All of these have to do with improving health and life expectancy. Indeed, a report for the Scottish Government suggested a ban on advertising unhealthy food, free fruit and milk, a basic income for healthy living, and a significant shift in the taxation system for both individual people and for companies to shift resources to where it's most needed.
And your focus on Unequal Scotland continues tomorrow. It comes to a sort of end for Reporting Scotland.
Indeed, we've talked about income, about wealth, about learning today, about health. There are big inequalities in all of these. Some might matter more than others, some might be inevitable. But politicians of all parties have talked about this for a while, probably since the financial crash. That concern has gone up. Talk's easy, much more difficult to get to the solutions. It's complex, politically difficult. Tomorrow we'll be hearing from the politicians on radio, online, also here on Reporting Scotland. And at 2 o'clock tomorrow afternoon on Facebook Live, you can put your questions and your opinions to me.